Assalamualaikum. I am Noshin Mustari. Welcome to my presentation. Now I am going to discuss the most and recent topic, the cause and the effect of dengue fever in Bangladesh. Let's start. Firstly, contents. Now I am going to discuss about introduction, epidemiology, what is the transmission, what is the mechanism, what are the signs and symptoms, what are the warning signs, what are the critical phase, what are the recovery phase, and what is the diagnosis of dengue fever and what are the prevention of dengue fever. Firstly, dengue fever is an acute infectious viral disease also known as breakbone fever. It is an arthropod-borne illness in humans. It is caused by infection with one of the four serotypes of dengue virus DENV 1, 2, 3, 4, which is a flavivirus. Once affected person acquire long-life serotype-specific immunity. Now I am discuss epidemiology. The mortality is 1 to 5% without treatment, less than 1% with adequate treatment. However, severe disease carries a mortality of 26%. Dengue is an epidemic in more than 110 countries. It affects 50 to 100 million people worldwide a year, leading to half a million hospitalizations and approximately 12,500 to 25,000 deaths. Dengue has become a global problem since the Second World War and is endemic in more than 110 countries. Apart from eliminating the mosquitoes, work is ongoing on a vaccine as well as medication targeted directly at the virus. Therefore, travelers returning from endemic areas are unlikely to have dengue if fever or other symptoms start more than 14 days after arriving home. Most are transmitted by arthropod mosquitoes or ticks and are therefore also referred to as absorvirus. There are types of there are four types There are four types of the virus which are called serotypes, and these are referred to the ENV1, the ENV2, the ENV3 and the ENV4. All four serotypes can cause the full spectrum of disease. Now I am going to discuss transmission. Dengue is transmitted by several species of mosquito within the genus Aedes, principally A. aegypti. Dengue virus is primarily transmitted by Aedes mosquitoes, particularly A. aegypti. These mosquitoes usually live between the latitudes of 35 north and 35 south below an elevation of 1,000 meters, 3,300 feet. They bite primarily during the day. Other Aedes species that transmit the disease include A. albopictus, A. polynesensis, and A. Scutellius. Humans are the primary host of the virus, but it also circulates in non-human primates. Now I am going to discuss mechanism of dengue virus. Dengue fever. When a mosquito carrying dengue, dengue virus bites a person, the virus enters the skin together with the mosquito's saliva. It binds to and enters the white blood cells and reproduces inside the cells while they move throughout the body. As a result, less blood circulates in the blood vessels and the blood pressure becomes so low that it cannot supply sufficient blood to vital organs. Furthermore, dysfunction of the bone marrow leads to reduced numbers of platelets which are necessary for effective blood clotting. This increases the risk of bleeding, the other major complication of dengue fever. Now I am discuss signs and symptoms of dengue fever. The characteristic symptoms of dengue are sudden onset fever, headache typically located behind the eyes, muscles and joint pains, and a rash. The alternative name for dengue breakbone fever comes from associated muscles and joint pains. Symptoms include fever, headache, muscle and joint pains, and a characteristic skin rash that is similar to measles. In a small proportion of cases, the dengue develops into the life-threatening dengue hemorrhagic fever, resulting in bleeding, low levels of blood, platelets, and blood plasma leakage, or into dengue shock syndrome, where dangerously low blood pressure occurs. Warning signs of dengue fever: abdominal pain, ongoing vomiting, liver enlargement, mucosal bleeding, high hematocrit with low platelets, lethargy. What are the critical phase of dengue fever? A critical phase which follows the resolution of the high fever and typically lasts on 1 to 2 days. During this phase, there may be significant fluid accumulation in the chest and abdominal cavity due to increased capillary permeability and leakage. This leads to depletion of fluid from the circulation and decreased blood supply to vital organs. Now I am discussing the recovery phase of dengue fever. Resorption of the leaked fluid into the bloodstream. This usually lasts 2 to 3 days. Severe itching and a slow heart rate. During this stage, a fluid overload may state occur. If it affects the brain, it may cause a reduced level of consciousness or seizures. Diagnosis of dengue fever. First of all, the diagnosis of dengue fever is typically made clinically on the basis of reported symptoms and physical examination. This applies especially in endemic areas. However, early disease can be difficult to differentiate from other vital infections. The earliest change detectable on laboratory investigation: low white blood cell count followed by low platelets and metabolic acidosis. Management. oral dehydration therapy, intravenous fluid and blood transfusion. Now, lastly, what are the prevention of dengue fever? There are no approved vaccine for the dengue virus. Prevention thus depends on control of and protection from the bites of the mosquito that transmits it. The World Health Organization recommends an integrated vector control program consisting of five elements. Number one, advocacy, social mobilization, legislation to ensure that public health bodies and communities are strengthened. Number two, collaboration between the health and other sectors. Number three, an integrated approach to disease control to maximize use of resources. Number four, evidence-based decision making to ensure any intervention are appropriately. And number five, capacity building to ensure an adequate response to the local situation. Number six, the primary method of controlling Egypt is by eliminating its habitats, reducing open collection of water through environmental modification. People can prevent mosquito bites by wearing clothing that fully covers, using mosquito netting while resting, and or the application of insect repellent. Thank you to all to hear me.